Alrighty, welcome back everyone. Let's take a look over here. We are going to go ahead and get started. So first of all, I want to welcome everyone back to Self Principle. This is the channel where we talk about everything related to health, to nutrition, to fitness, and of course,
for 3 days only, May 4th through 6th. Get excited.
So with that, let's go ahead and dive into today's topic, which is going to be about microplastics. We're going to go through and talk about what are the pros and cons you need to know about it, how you can start to make changes in your own life regarding this really prevalent and important topic that, in my personal opinion, I don't think it gets as much attention as it deserves. And then after that, I do want to give you a little bit of an update on a topic that we started talking about last time, which was in regards to the issue of pig kidney transplants and what the latest update on that is. And then we'll finish off with a new study about the ketogenic diet and how it can play a role in certain disorders like schizophrenia, bipolar disorder. So I see a whole lot of you guys are already online, so that's awesome. Let me go ahead and get to everyone's questions in a second. We'll go ahead and dive right in first into the research. And so with that, let's talk about this world of microplastics and what is the kind of stuff that you really want to know about it. So the first thing that you want to know about microplastics, by definition, they're classified as being less than 5 millimeters. Now, that's just a formal definition, which is essentially less than 0.2 inch. But when you think about it, from there, it just gets smaller and smaller and smaller. In other words, they'll go down to 1/25,000th of an inch, or in other words, 1 micrometer. Why should you care? Because as we get smaller and smaller, you're going to start to hear about how these can penetrate all sorts of things. Whether you're on an animal-based diet, or you're on a plant-based diet, it will not matter because microplastics, they can easily penetrate the seeds, the roots, the leaves, all the way down to the cells of individual plants. The same thing applies to animals since they're taking in the food stock that has a lot of these microplastics. Now, the ultimate question becomes is, well, what about people? We consume all sorts of foods that are contained in plastics. It's really interesting that I started looking around my house to start to think about, I think I'm kind of aware and cognizant of plastics. I don't think I have a lot of stuff. I was so shocked that as I started looking around, literally 80 to 90% of the things in my household that I look at are stored in plastics, are contained in plastics, are consumed by my kids or myself in plastic containers. So we'll talk about why this matters so much in a second, but there's a bunch of studies out that talk about how these microplastics are found in food. And so, for example, there are certain people out there who'll talk about things like Himalayan pink salt, and they'll claim all sorts of things, how it's supposed to be better than salt. The answer is not really. It's not really better than salt. But what ends up happening is there's an interesting study that shows that when it comes to microplastics, Himalayan pink salt actually has the highest amount of microplastic load. That's very interesting. And then on the flip side, when you start to think about marine salts or sea-based salts have lower amounts of microplastic. Then it comes to things like sugar. We're all talking about sugar these days for a variety of reasons. Diabetes, heart attacks, brain damage, all sorts of things that sugar impacts, which all lead to kidney issues. But what's interesting is that sugar is actually a very large source of these microplastics. How fascinating is that? That microplastics become so abundant. And one of the things that I wasn't aware of that I found out was there was a study from McGill University in Quebec, Canada, where they found that brewing a single plastic tea bag, it ends up releasing about 11.6 billion. This is one single tea bag, releases about 11.6 billion microplastics and 3.1 billion nanoplastics into the water. How crazy is that? That just the act of brewing a tea bag is so powerful. And even when it comes to things like rice, my wife is Vietnamese, I'm Pakistani, we eat rice. That's something that we do. Well, it turns out that rice can actually have a lot of microplastics in it. And so what happens is washing the rice makes a big difference. In fact, you can reduce the contamination of microplastics in rice by as much as 40%. 40% by simply washing the rice. Then it comes to water. Now, I have to tell you, I make an effort to always drink more water. I always try. And I have my steel containing water bottles that I always use. But, just today I was working on the research around microplastics, and I look at my table and I didn't even realize I'm drinking water. We just moved back to our old house. And so everything is in boxes and we're unpacking. And so this morning I grabbed a water bottle and started drinking. And then I realized, how incredible is it that we do this stuff out of habit and we don't even realize what's happening. So here's where it's very interesting. If you look at two standard size, essentially 1 liter bottles, so two standard size, this is half a liter. So two standard of these water bottles, they contain on average about 240,000 plastic particles, including nanoplastics. And what's fascinating is there are so many different types of plastics that are found in this, aside from the most common one, which is polyethylene. So now the ultimate question that everybody wants to know about is, okay, that's fine. We live in a world that's plastic. So what does that really mean? So there's a study that just got published in the New England Journal of Medicine that you may have heard about. It's raised all kinds of excitement, interest, fear. So let's dive into the study a little bit so you understand what the take-home message behind this study is. So the study was looking at 257 people who are essentially going a carotid endarterectomy, which is basically cleaning out one of the main blood vessels in your body. And what they found was that essentially in these people, if they had microplastics, and it turns out that in their blood vessels, about 58.4% had microplastics or even smaller nanoplastics inside their main artery, carotid artery. So what did this mean? Well, those that had it were 4.5 times more likely to experience a heart attack, stroke, or death in about 34 months after surgery than those whose arteries were plastic-free. Now, there's all sorts of criticism about this. This could be correlation. It just so happens that it's present. It doesn't mean causation. What's the proof that it does something? This is only one study out of a growing field of studies that's raising the issue of what do these micro and nanoplastics do? And we don't know, but in animal models, what we understand is that there is the possibility that these micro and nanoplastics, they create inflammation. And that inflammatory response creates this whole cascade where these macrophages rush in to try to get rid of these foreign particles. And as a result, you have all of these inflammation. So remember, when we talk about kidney disease, there's no data on plastics and kidney disease, but the same principle applies that microplastics are filtering through the kidneys. They might be getting stuck in the kidneys and they might be creating inflammation. So the question really becomes is, because this is an emerging field, what do you need to take home? Should we all freak out and panic? Absolutely not. There's a lot more to learn, but by the time science gains enough information, you don't want to have 10 years go by where you could have done something. So here's what you want to understand. Since the last 2 decades or so, from 2000, plastic waste has actually doubled. And what happens is none of us are doing a good job of recycling or just trying to make better choices. In fact, 90% of plastics end up in landfills. And what happens in landfills? They break down there. Those micro and nanoparticles go into the soil. They make it into the water streams. Eventually, they're making it into our food supply. And of course, they're making it into our bodies. So being able to recycle makes a difference. Number 2, watching out for single-use plastics. I started this conversation by saying how I'm completely guilty of this, and this is without me even thinking about this. And part of, I hope you see, part of the way that I've always presented information is to show you where I make mistakes so that you understand. A lot of people on the internet or other places, they act like they're perfect. Ask my wife. I am far from perfect. I make a ton of mistakes. And so the hope is I can share those with you because we have this relationship, and I can make sure that you can learn of progress over perfection. So these single-use plastics, the plastic water bottles, the plastic bags, the product packaging, the straws, the plates, the cutlery, they make up 40% of the plastics every year in production. 40%. So just think about those basics. If you were to be mindful and start to cut back, and if you do it, to make sure you recycle, how amazing it would be. I didn't know the statistics, but the average American ends up generating 487 pounds of plastic waste each year. 487 pounds. That is an insanely high number. And so all of this means is, while we're reading on the literature, there's a few basic tips that we can take away. So first, it makes sense to avoid plastic containers, to avoid those single-use plastics that we talked about. Look for items or keep your items stored in glass, in other material, but don't use plastics. Even when it comes to clothes, try to find clothes that are made from natural materials. You know, it's fascinating that even now, if you're somebody on a budget, you can find clothing that is very inexpensive, made from natural material. In fact, most outlets are starting to advertise that as a way to be able to sell products. So look for those labels. Don't microwave in plastic. If you can, change it to something. Use an other object, for example, glass. Glass is an underrated substance, but think about microwaving in glass. It makes a difference. And then as far as foods goes, remember, the more processed the food, the more likely it is to create microplastics already in there. Once again, more processed, ultra processed, those are buzzwords. Not only they're bad for your health from a nutrition perspective, but from also these microplastics. And think about those microplastics, how they're ending up in the brain. What about the inflammatory response there? What about things like dementia, Alzheimer's? Don't know. Don't want to scare anybody, but I can tell you, at least on my end, I do want to start being thoughtful about it and start to take action on it. All right, before we go to the next topic, let's take a look at our chat and answer some questions. Barbara, hi Barbara, nice to see you again. Barbara said, your answer to my question last week was so helpful in answering something I've wondered about for a long time. Barbara, I'm so glad I could be of help. Tyler said, I hope you're having a great week. I wanted to ask you about the benefits of CoQ10, 100 with CKD stage 2. So this is really interesting. You know, CoQ10 is initially studied for heart failure. That's where it gets its claim to fame from. Its side effects wise are very, very low. As far as that goes, it can potentially help in blood pressure. It does not affect the kidneys. And the dosage, it really depends on what you're taking it for. As you know, I have migraine/seizures. So on my end, I end up taking CoQ10 on a daily basis along with riboflavin, along with magnesium. That's part of my cocktail that I do every day. And that's just based on the evidence around migraines. And that seems to be helpful in terms of my own situation. Lee said, I'm very grateful for your help in assisting me with my kidneys. Lee, thank you so much for those kind remarks. I have stage 3B renal failure, and SGLT2 inhibitors can cause pancreatitis. Do you have any alternative medicine I could use, please? So in terms of if you have protein in the urine, you know, SGLT2 inhibitors can be incredibly beneficial. A lot of people will look at the side effects and get very concerned. You can use a very low dose of it and be very mindful in how you're using it. The big stuff is to have a nephrologist that can monitor your condition closely. There are ACE inhibitors, like all the prils, lisinopril, enalapril, so forth. There are mineralocorticoid antagonist, spironolactone. There are other ones like finerenone that we've talked about. So now we have all sorts of options. ARBs are another option. All of these things are kidney protective. Even the weight loss drugs, or quote unquote new diabetes drugs like GLP-1 agonists. Common names are semaglutide or liraglutide or tirzepatide. Brand names being Ozempic, Wegovy, Saxenda, Victoza, Mounjaro, Zepbound. All of those names can also be kidney protective, and it really depends on what your risks are for pancreatitis, so you want to talk to your doctor about it. But in other words, there are a ton of options. And so Karen said, good evening and happy Friday, Dr. Hashmi. What are microplastics? So microplastics is just a fancy way of saying, if you look at a plastic container, microplastics are basically the shedding of the plastic in this container. So you're getting material that may be less than 5 millimeters all the way down to micrometers. The smaller it is, the more it can penetrate all sorts of different things. That's all we're talking about when we talk about microplastics. And so Carol said, do microplastics affect the gut microbiome? Carol, the official answer is nobody really knows. But the unofficial answer is, based on the idea that they're a foreign substance that will create an inflammatory response, my educated guess, but it's a guess nonetheless, is absolutely they would. Absolutely. Donato said, hi doctor, how long does it take for olmesartan to lower protein in the urine? Started it 2 weeks ago. So, we always check labs for things like potassium in about 1 to 2 weeks. But as far as the antiproteinuric effects, we usually don't measure those for at least 2 to 3 months. But that doesn't mean the drug isn't already working. It's absolutely working. And remember, Donato, with medications, don't forget, you do need to lower your weight, you need to lower your blood pressure, you need to engage in physical activity, you need to make sure you're getting enough sleep, and the most important thing we never talk about is stress. You got to work on stress. Casey, let's see. Casey said, I'm on 50 milligrams of losartan for blood pressure. Albumin creatinine ratio is in 400s. Is it better to increase the dose of losartan or try SGLT2? So I always add SGLT2 to my patients. That's a standard best practice that I do regardless of the dose of losartan, because of the fact that it's better to have different mechanisms acting to lower the protein in the urine. So instead of going the maximum dose of one, I try to use different mechanisms to attack the problem to get better results. Teresa said, hi doctor, what do you know about fibroid immunization and its effect, positive and negative? Teresa, I don't know. And so I'll have to look, fibroid emulation, either way, I don't know. So I'll take a pass and, if you can explain it a little bit more so that I can look it up for you and come back to you with it. Hi, Van. Thanks so much for joining. All right. Let's go to the next topic, which is I wanted to share really exciting news, which is the second pig kidney transplant just occurred in another person that's extremely ill. Now, as you know, when we talk about pig transplants, there's a lot of concerns. There's ethical concerns. You shouldn't have animals being bred just to be able to do these transplants. Then there are human concerns. For example, I don't know if folks on the call know this, but there are more than 100,000 people who are currently on the wait list for organs. 100,000 people. And about 17 of them, 17 die every single day because they can't get one. And that includes older folks, but it also includes younger folks. And it doesn't spare any gender, and it doesn't spare any race. And so this becomes a really difficult situation. My hope is that this is a bridge to where we can actually have the one artificial kidney that we're still waiting on, because the technology still needs to get to the point where these artificial kidney thoughts are not battery powered, but they're powered by the pumping of the heart instead. So in other words, we need that technology to get good enough so that once you implant the kidney, there's no power supply that's needed. Still looking out for the literature, still hopeful. There's a lot of folks working on this idea of an artificial implantable kidney. There's a lot of people working on the idea of lab-grown kidneys. So there's so much to come so far. But here's what matters. You actually have, for the first time in our lifetime and in anybody's lifetime before us, we have two people who have successfully gotten an organ from an animal into us, and now they're doing well. And this is truly a game changer because it will help so many people in the long run. I wish that there's another way to do it, but I also know that far too often I've had to be at the bedside of patients who I've literally had to say there's nothing more we can do and watch them take their last breath. That is one of the hardest things to go through. So I just want to make sure that you are aware of these things that are happening, to also understand that in the world of medicine, there is so much more hope than there was ever before. Hope is a 4-letter word. So is a lot of negative 4-letter words, but there's a lot of positive 4-letter words too, like life and hope. So remember that. All right, now, I thought I would share with you a study that just came out because of the fact that a lot of times when we see people on the internet, there are diet wars. And what I mean by diet wars is people always say, look, my diet is better than your diet. And therefore, I'm always going to present studies that only support my diet, because guess what? I just want to make sure that you understand that my diet is the best diet out there. So I thought I would share with you this really interesting study on a ketogenic diet. And remember, you can do a ketogenic diet and modify it to be more plants, to be able to fit your needs. A ketogenic diet does not have to be one that's filled with saturated fat. It doesn't mean you're going out and eating bacon like crazy. It could mean that you're having nuts, you're having avocados as your sources of healthy fats. So just because there's the word ketogenic or keto diet, don't immediately think that it's negative, and don't immediately think that it's positive. Most people on the internet actually have no clue what a true ketogenic diet is. They just think that it's a license to eat every bad food out there and that nobody else knows anything about saturated fat. So with that being the case, let's talk about this study. So, one of the things that's interesting about a ketogenic diet is there's very good data when it comes to epilepsy. There's very good data when it comes to migraines. When you look at obesity, you can see that keto diets, low-carb diets, plant-based diets, they all help in losing weight. So there's data around all of them. And when it comes to type 2 diabetes, it matters. I've also shown really elegant studies on this channel where if you do a keto diet and you then start to reintroduce sugar, your body doesn't know how to handle sugar, so it can start to damage the endothelial lining. So everything has to be taken in context. But a ketogenic diet can be done safely, it can be done properly, but it does require supervision to be done properly. If you remember the episode we did on polycystic kidney disease and how we showed that if you deprive the cysts in the kidneys of sugar, you would prevent them from growing, and in some cases you would cause them to shrink. You can just use the search function and look up that video that I did on PCKD. Fascinating data. So here, this is a 4-month study. It's just a pilot study. And here what they were trying to test was, does a ketogenic diet have any sort of positive or negative effect on patients who have underlying schizophrenia, clinically diagnosed, or bipolar disorder? And so there weren't a lot of people in the study. There's only 21 people in the study, 5 with schizophrenia and 16 who had bipolar. And what they wanted to see was what would be the impact. By the way, this is a single arm trial. There is no secondary control arm or anything like that. So that's a flaw, and you have to know about that. So at baseline, what happened was all of the folks, they got physical examination, they got psychiatric evaluation, they got instructions on how to follow a ketogenic diet, and their definition, this is very important because how you define a keto diet varies in the community versus in the medical literature. So in the medical literature here was 10% carbohydrate, 10%. And it ended up being 30% protein and 60% fat. And what they did to ensure these people were in ketosis is that they measured their blood ketone levels weekly. And so what they found in the study was that the folks in the keto arm, they had a 12% reduction in their weight. That is significant. Remember, Ozempic causes around 15% in studies. This is 12% that they're getting in this particular study. They had a BMI reduction of 12%. Their waist circumference went down by 13%. Their visceral adipose tissue through imaging studies went down by 36%. In terms of insulin resistance, they measured through HOMA-IR. They saw a 27% decrease. And triglycerides, remember, triglycerides go up with sugars. They saw a 25% reduction in triglycerides levels. But here's where it becomes really interesting. In psychiatric measures, they use different scales. There's the brief psychiatric rating scale scores. They saw a 32% reduction in those scales in patients who had underlying schizophrenia. And when they looked at essentially the overall clinical global impression in terms of overall mental health, the severity of their diseases improved by an average of 31%. This is absolutely fascinating. And along with all of those things, their sleep quality increased by about 19%, and their life satisfaction increased by about 17%. So what's the take home from all of this? Is if you're looking at stuff like issues with the brain, migraine, seizures, so forth, there is something about creating ketones. And you can create ketones through a ketogenic diet. You can create ketones through intermittent fasting. We've talked about that on various studies. So there's something about creating these ketone bodies. And those ketone bodies, what's fascinating is that turns out they're somehow neuroprotective. They protect the brain. They lower the inflammation and oxidative stress. And so if you're somebody who can't do a ketogenic diet, that makes sense. You don't have to do it. But if you're somebody who's thinking about doing a modified plant-based version, cutting back on the carbs, incorporating fasting, adding in some MCT or medium chain triglycerides. If you're doing those things, you can actually get tremendous amount of benefits. So the whole point of presenting the study and the data on this is so that you realize there are so many different ways to treat things. And don't get into this concept of my diet is better than your diet. Nobody cares about any of that. What they care is are you a kind person? Or are you a not so kind person? Let's look at some more questions in the last couple of minutes. Let's see. Teresa said the procedure cuts off the flow of blood to the fibroid and thyroid, and then they calcify, but they are left in the body, and I have one that is sitting on my bladder. How does that affect kidney function? So Teresa's question is about these procedures that essentially allow different areas of the body. They're going to reduce the blood flow, and that part will be left. For example, if it's a fibroid, it's left in the body. So Teresa, that should not impact your kidney function at all in terms of that going on. So I don't see any reason why there would be any impact from that. So I think you should be perfectly okay. You know, you should definitely talk to your doctor in terms of how they did the procedure and if there's any more precautions to take. Certainly not my area of expertise. I don't have a lot of understanding of it. But as a kidney physician, I have never encountered anything in the literature that related to any procedure like that affecting your blood flow. Casey said blood pressure is often below 120/80, but sometimes 120s to 130s over 80. Is that still high? I work out and try to limit my salt already. Casey, so what's interesting is, you know, we talk about being less than 120 as optimal. If you're over 120s to 130s, that's fine because you are somebody who's physically active, who's doing stuff. So I think that's wonderful. So at the end of the day, I wouldn't give it too much thought and I wouldn't make a big deal out of it. I would continue the healthy lifestyle. And don't forget, if you got a lot of stress in your life, if you don't eliminate the stress, and I can tell you, I'm speaking for myself, I have a ton of stress and I'm really working to be better with it. But stress is one of the most overlooked things in our lives. All right, with that, the time is now 5:30. And I just want to once again tell you guys, thank you so much for your support in these weekly live episodes. I hope you find these helpful. Once again, the best gift you could ever do for me is just to go ahead and spread the word. Around every Friday, 5 p.m. Pacific Standard Time, we do a live episode. And essentially what I try to do is find interesting studies that you will have value added to your life that you can immediately take action on. And with that, I just want to thank you so much from the bottom of my heart. And just remember, at the end of the day, nobody cares about your diet, about your money, everything else. I have seen so many people leave this beautiful planet for good. And I can tell you the last wish they had was just about being kind. That's it. So my only message to you is you can always be all sorts of things. And if you can be anything, the greatest thing you can ever be is just be kind. With that, thank you so much. Thank you for supporting the Self Principle, and I'll see you guys next week.